Aventura is a company that focuses on workflow for caregivers, and we dynamically roam desktops and give doctors and nurses sort of what they need, where they need it, and when they need it. And what we're seeing in the hospitals that are adopting our software is literally staggering productivity gains. One hospital claims that their average nurse who used to work 2 hours of overtime per shift is down to 15 minutes. Another hospital claims that their average nurse is saving 87 minutes per shift. The average doctor is saving 43 minutes per shift. Another hospital claims that in orthopedics, their average doctor is seeing 6 more patients a day. But the irony is that even though that productivity gain is the reason why most people are interested in the software, once they actually implement it, it's not what they talk about. You know, my line is that one of the elephants in the room in healthcare is that all this incredible amount of money, literally hundreds of billions of dollars, is being spent integrating technology into a hospital. And the thing nobody talks about is it's not working, right? Caregivers find it incredibly hard to integrate that technology into their workflow, into how they do their jobs. And we fix that. And that's actually what people focus on once they use the software. A lot of the things that are being talked about in healthcare are things that we've done in other industries long before now. And so what I'm really aware of is, and I've actually spent a lot of time talking to some pretty senior people at some pretty big companies, is sort of some of the gaps in terms of how healthcare takes advantage of the technology that really does exist in the world to change sort of, you know, the performance and behavior of what people are doing, and the incredibly hard change that is in healthcare. Doctors and nurses didn't go through school and aren't in healthcare because they want to play with technology. They came to healthcare and they're in technology because they want to be great doctors and nurses. They want to save people's lives. They want to impact quality of care. Virtually none of them believe that healthcare technology helps them do that. We're trying to change that. I think a lot of doctors want to use iPads. I think nurses don't. And in fact, when I talk to CNOs, what they say is, my nurses wear gloves, they have wet hands, they don't need another thing to carry, they don't need another thing to lose. So I actually think saying doctors and nurses want tablets is probably not true. On the other hand, one of the things we're showing in our suite right now is our new mobility solution. And we actually can not only deliver what we're delivering on endpoint devices, we can deliver it on iPads as well. And we're actually showing that for the first time upstairs. And we can actually deliver our capability to any endpoint device, and including any mobile device, any Android device, any iPad, any tablet. So we think mobility is an incredibly important part of the picture. But we also believe strongly that it's going to be a mixture. The idea that people talk about, oh, in another couple of years, everybody will be carrying tablets and that'll be the way they do it, yeah, that's not true. The answer to what the optimal delivery mechanism or form factor for healthcare is easy, right? There's been an enormous amount of debate of what's going to be the definitive healthcare device. And the answer is easy. There will never be a definitive form factor. There will never be a definitive endpoint device for healthcare. Some doctors are going to want to use tablets. Some nurses are going to want to use iPhones. Some people are going to want to have thin clients in every patient room so they don't have to cart anything around. One of the things that we do is focus on the idea that the endpoint device should be totally irrelevant. That we should be able to say to a congregation of doctors and nurses and caregivers, pick whatever endpoint device you're comfortable with, and we'll deliver everything you need to that device. We are totally agnostic on hardware, and that's critically important. There will never be a single device that everybody in healthcare will rally behind and say, that meets my needs. Everybody's got different perspectives on what they want to use. The thing you've got to do is have software that's so powerful, it makes the endpoint device irrelevant.